Welcome back to Urgent Care Unscripted, where we dive into real conversations about health, wellness, and what really goes on behind urgent care. I'm Barbara Ronalter. I'm the Director of Operations and Business Development for AFC Urgent Care in West Haven.
And this is Muhammad Zaman. I am the owner and franchisee of AFC Urgent Care West Haven. Today we'll be talking about an interesting topic. It's about when people are already on their way or sitting in the urgent care clinic but have not thought about in advance how to make the best use of your time at the clinic or how to maximize your visit at the clinic.
Absolutely. We see this every day. People come into the clinic, they're in a rush, and today we're going to break it down how to make things a little bit faster for them. And one of the things we're going to cover today is what to bring and how to prepare for your visit. We're also going to talk about communication and how to communicate effectively with your provider and your clinic, and tips on how to make the best of your visit, make it smoother so you get the most of your visit.
Sure. And just let's start from the beginning. Before you have even started, what can you do? You could make an appointment, or you could walk in. Both options are available typically at all urgent care, especially at our AFC Urgent Care West Haven. But making an appointment in advance actually saves you some time. You spend less time filling in the forms at the front desk, and you get to see the provider sooner. And that helps you, that helps the clinic keep the operation efficient.
Yep, it's a big time saver. It definitely speeds up the process when you come in and all your paperwork is already completed. Obviously, not everybody has the time to do it ahead of time, so you can definitely come into the clinic and do the paperwork there, but we'll definitely get you in and out way faster if you get that done beforehand.
Talking about paperwork, what are the two main paperwork that's needed? A very easy guess. It's your photo ID and your insurance card. Without a photo ID, it could be a physical form of ID or it could be a digital form of ID, but without a photo ID, it becomes very difficult to see a patient. So we ask that you make sure that before you have stepped into the clinic, either you have a digital version of the ID or a physical version, and obviously having the insurance card also helps.
Yeah, and the next thing that I just kind of want to point out regarding this visit and making it faster is communication. So one big thing is making sure you're effectively communicating what it is that you need at the time of your visit. Keep in mind that it's an urgent care. Typically, our time is limited, unfortunately. So if you're coming in and you have, a couple of symptoms, you want to make sure you're addressing your most important symptom first. The one that you want to resolve today. So if you're coming in with various things like a sore throat, but you also have, your back has been hurting for 3 months, you might want to address your sore throat first, and then you can either we can touch on your back pain later, or you can come in a couple of days later, or we can schedule follow-up to kind of go more into depth on those symptoms.
And just expanding on what Barbara just said about planning ahead. Like she said, you could come in with many different symptoms or treatment needs. It could be one, it could be multiple. But planning ahead definitely helps because that keeps the process efficient. That helps the provider plan ahead and save you time. That brings a good example of a patient that came in. Actually, this patient, and Barbara can expand more on it, she wanted to be seen in 45 minutes during her lunch break. The best thing she could have done is she called us around 11 that, hey, can you accommodate my need? I have to be seen. I have such and such concerns, but I only have 45 minutes. Because she called ahead, we could plan with her, she could plan with us, and she was in and out in 45 minutes.
Yeah, absolutely. It's definitely not something we can accommodate for every single patient. But if we know ahead of time, we can let you know what to expect. If it was something that we couldn't accommodate at the time of her visit, we would have told her.
Yeah, so transparency, like she said, goes both ways. If you communicate to us, then it becomes, a clear communication from both ends. We know what your expectations are, and you know what we can do or not for the time you can afford to spend at the urgent care. And then we can set up a realistic expectation of when you should come, how long you can expect to be seen, and when you can actually get out with good results.
to make things a little bit faster for the patients too, we make sure we send all of our prescriptions electronically. I know that some providers might still do paper or might call in the prescriptions. One thing that we like to do is send over the prescriptions directly to the pharmacy, and making sure that is also done effectively and as fast as we possibly can. I think, Mohammed, do you want to go a little bit about some final tips and
Sure.
else?
So just so everybody knows, it's an urgent care, right? So you come in here for flu, for COVID testing, or you have a fever, or you want to do a physical like a DOT physical or annual physical. All of those things we can accommodate at the clinic. But then there is a difference between us and the emergency room, right? So if you have a chest pain, if you have difficulty breathing, or if you have some kind of a sign that's symptomatic of a stroke, this would not be the place. You would be best served if you immediately contact an emergency room or a hospital to get treated versus seeking help from an urgent care.
Absolutely. And feel free to call us. We can definitely give you some advice. We can't obviously give you medical advice over the phone, but if you tell us what your symptoms are, we can best advise you on whether to come in and see us, or if we think that you would be better served at an emergency room. We do understand emergency rooms, wait time can be a little bit longer, but when it comes to an urgent care, there could be some circumstances where we are limited to what we can do within our walls. So definitely call us ahead and let us know what your situation is if you are unsure about where to go. To wrap up, I think we want to just talk about, book online, big help for you. Bring your ID and your insurance card. Make sure you're focused and direct with your provider. Tell us up front if you're on a time crunch. Ask if there's anything that we can do, and obviously be open and clear with your provider.
Sure. So communication is key. And with that note on communication, we'll catch you next time. Until then, subscribe to Urgent Care Unscripted. This is Muhammad, and with me, my co-host, Barbara. We'll see you next time.
See you next time. Thanks so much for tuning in. And we are at 354 Sawmill Road in West Haven. Come see us anytime you need us.